Good morning, YouTube. It is Jennifer. It is Monday, March 12th, 2012. Um, Sorry for this. um, really tired and um, like I was pre-op, I would sleep for a couple hours, wake up for a couple hours, sleep for a couple hours, wake up for a couple hours, and I just can't get a schedule down, so I just am tired. I don't feel tired like I did pre-op, but I'm still tired. Anyway, let me get to the numbers because I'm going to try and make this video as short as I can. My weight the morning of surgery was 301. I'm not going to do the 301 point blah blah blah. I don't care what what comes after the point. So it was 301 the morning of surgery. The next day when they have you walking around and they want you to do your weight, I was 310. Because you know that they fill you full of gas during surgery and then all your IV liquids and antibiotics and all that stuff. So you gain weight while you're in the hospital. So I was 301 the day of surgery, 310 the day after. And I weighed myself this morning, which is 1 week post-op, which is crazy that I'm post-op. It still hasn't really hit me, but 1 week post-op, my number this morning was 294. So that's 7 pounds lost since my pre-op weight and 16 pounds lost since after surgery. I really have no comment about those numbers. I don't see them as good or bad. It's just I'm supposed to lose weight with the surgery, and I guess I am. Still having a lot of pain in my stomach, and my stomach is sensitive to seems my stomach is sensitive to everything I eat, especially things like the sugar-free popsicles, or decaffeinated tea, or soup. Those are really the three things that just make everything from here down just gurgle. And I take my antacid every night to reduce the stomach acid, but my digestive system is just angry. It's very angry. Does not understand why it has to work this way now. And I do want to update something that I said in my last video. When I said that I was off all my medications, I guess I should have clarified that that does not mean that my doctor took me off all my medications. I took myself off my medications because I know how I was pre-op, and I know, for instance, if I didn't take my Advar inhaler for 2 days, I would really feel it in my chest, and it would be hard to breathe, and I could feel it closing up, and I don't have any of that now. My depression medication, which is the Zoloft, if I wouldn't take that, if I even missed a day, I would definitely be able to tell. And I know a lot of doctors say, oh, it takes a week or 2 or 3 for it to kick in, or for you to notice any withdrawal. That's not for every patient, and I'm one of those patients that even when I start a medication or I end it, I immediately feel the results. And I really haven't felt the need to have it other than just being super emotional lately. For instance, just laying in bed and there's tears coming down my face, and I'm sitting there like this, okay, why are there tears coming down my face? I'm not, it's just it's kind of crazy stuff. But I'm going to chalk it up to going through a lot of stuff in the past week. So I don't know if I will consider going back on my depression medication if it starts to, if my emotions start to interfere with daily life. But right now I'm just kind of at home trying to adjust to everything, so I don't think it's totally abnormal. And all the other little medications I used to take, I don't feel the need to take anymore. I'm taking my antacid, which is my Prilosec. I take half a tablet, I cut it in half, and just take the pill. And then I take my iron supplement, which I take, not bariatric, I got it from Bariatric Advantage. And of course I can't remember the name of it now, but it's an iron supplement with calcium, with vitamin C, The vitamin C helps your body absorb the iron. So I'm taking that. Wednesday when I get my paycheck, I'm going to go get a multivitamin, probably Flintstones, because as long as the multivitamin is chewable, complete, and sugar-free, I can have it. And the multivitamin I have is disgusting. I cannot chew it. I'm really, really sensitive to flavors and textures, and for some reason I could take my chewable iron, which is great, but I can't take my chewable multivitamin, which is orange. I don't know why. Other than that, I really don't have much to report. I'm still on liquids. I'm going to try. I'm supposed to be, they said be on liquids for a week, which to me would be today. But to the clinic, the barracks clinic, they consider 1 week being 1 week from the day you're discharged, which I don't really understand because I've been on liquid since I woke up from surgery on Monday. Granted, I didn't want to eat Monday or Tuesday, and I just ate ice chips all day, but I was allowed to eat liquid since then. So I'm just gonna maybe try to incorporate some of the pureed foods today, which I'm so looking forward to. I've never wanted mashed potatoes or chili more than I want them right now. I'm so sick of liquids. I did not think I would be sick of liquids. I have a wide variety of liquids that I could eat here. I'm just so sick of them. I'm starting now to feel like not full, and that's why I think I should move on to the pureed, because liquids was fulfilling for a while, and now I'm just like always hungry. Yeah, but other than that, I don't really know what else to say. My stomach still hurts. I'm not taking my pain medication that often anymore. Usually I just take half a dose at night before I go to sleep. And for some reason now, if I take a half a dose, it doesn't make me tired. It keeps me up. Whereas if I take the whole dosage, I fall asleep. But I don't need a whole dosage, and I'm afraid I don't want to I want off medications. I don't want to keep taking them. So, yeah, but besides that, so I really haven't gone for a walk. I was going to go for a walk yesterday because it was 65, it's sunny, and I don't know if you could see it outside today. And you'll have to excuse my house because it's a mess because I have a 3-year-old living here. Well, you can't see, but it's rainy, which I actually like rainy days, but it's all rainy. So I can't go out walking today either, which is probably okay because yesterday as I was getting dressed to go for a walk, I was like, yeah, this isn't going to happen because I have 7 incisions, and the ones on the 2 on the left side are just really giving me a hard time. They're not draining or anything like that. It's just they're really sensitive. I'm assuming because of bruising and things, but so anyway, rambling. Point is, I lost 7 pounds post pre-op weight, or 16 pounds since surgery. I'm tired, and I should have taken a shower before I made this video, but I'm going back to bed, so I didn't see the point. And I guess that's all. This week ahead, introduction to pureed foods. I really can't tell you how excited I am to eat mashed potatoes. It's like the highlight of my week. And I get to drive at the end of this week, which is good because I have I think at the end of this week is my post-op visit with my doctor. So I'm going to ask him, and I don't know if any of you know this, but when you're gastric bypass, is the size of your pouch and the size of your stoma that leads to the pouch, is everybody's the same size, or does the doctor determine how wide your stoma should be and how big your pouch should be depending on who you are? Because I feel like I can gulp water, and you're not supposed to be able to gulp water, but I can gulp water, and I might have to keep it in my mouth for a second and slowly, swallow bit by bit, but you're only supposed to be able to take sip, 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 and I don't have to do that. So I want to ask him that on Friday. And one little quick thing I want to say, because I thought it was funny, was last night my niece would not eat her dinner and she had pizza. And oh my goodness, I wanted a piece of pizza so bad. So I asked her for a piece of pepperoni. And my sister got mad at me and said, "No, don't give Jen any pepperoni. Don't give her any." And my niece was like, "She can eat it if she wants." I mean, she was like really upset that my sister would not let me eat this piece of pepperoni. And she got so upset that my niece told her no, that she ran to her room and she refused to eat her pizza. So the only way we got her to eat her dinner last night was to tell her that my stomach hurt so bad that I could not eat pizza because my stomach hurt, and that I really needed her to eat the pizza for me. Reverse psychology we thought was working, and she didn't. She did eat it, and she's like, "All right, I'll eat it for you." Until she got done with the first piece, and then she's like, "Here, you eat a piece for me." And I was like, "Oh, child, you're too smart." Anyway, yep. So that's that. I will update again next week with my week 2. Until then, if you have any questions, feel free to ask. I'm on Facebook, facebook.com/SIVA418. Send a request and just let me know that you saw me on here, and I'll probably accept you, because all I talk about on Facebook is my surgery and my eating and how hungry I am. So I guess that's all. I will talk to you guys soon. Have a good day. Bye.